In this video, we will review a critical antiarrhythmic medication, Flecainide Acetate. This drug plays a vital role in managing specific cardiac arrhythmias, but it comes with important considerations. Let's explore its indications, action, adverse reactions, contraindications, nursing responsibilities, and patient education. Starting with indications. First, let's discuss why we use Flecainide Acetate. This medication is primarily used to treat paroxysmal atrial fibrillation flutter, ventricular arrhythmias, and supraventricular tachycardias. Let's briefly go over each use and how it works. Paroxysmal atrial fibrillation flutter. It helps restore normal sinus rhythm in patients without significant structural heart disease. Ventricular arrhythmias, specifically sustained ventricular tachycardia in life-threatening cases. Supraventricular tachycardias, for patients unresponsive to other treatments. Alright, moving along, let's now learn about the action of Flecainide Acetate and how it works. Note that Flecainide is classified as a Class 1C antiarrhythmic, and here's how it works. It blocks sodium channels in the cardiac conduction system, slowing the depolarization of cardiac cells. By delaying conduction, it reduces abnormal electrical activity and helps stabilize the heart's rhythm. Important to know, while effective, it can prolong the QRS complex, indicating slowed conduction. Adverse reactions. Like all medications, Flecainide Acetate has potential side effects, which are proarrhythmic effects, CNS symptoms, cardiac issues, GI effects, and rare effects. Proarrhythmic effects. It can exacerbate or induce arrhythmias, especially in patients with structural heart disease. CNS symptoms. Dizziness, headache, and visual disturbances are common. Cardiac issues. Worsened heart failure, bradycardia, or QT prolongation. GI effects. Nausea and constipation may occur. Rare effects. Hepatic dysfunction and hypersensitivity reactions. Contraindications. Flecainide Acetate is not for everyone. Here is what this medication is contraindicated with. Structural heart disease, including recent myocardial infarction or significant left ventricular dysfunction. Pre-existing heart block without a functioning pacemaker. Brugada syndrome due to increased risk of ventricular arrhythmias. Hypersensitivity to Flecainide Acetate. Always assess for drug allergies. Nursing considerations. Remember that as nurses, we play a critical role in ensuring the safe administration of Flecainide Acetate. Here are some nursing considerations. When administering Flecainide, nurses should do the following. Obtain a baseline ECG, monitor cardiac rhythm, assess for CNS effects, monitor renal and hepatic function, check for drug interactions, and administer as prescribed. Let's briefly go into more detail for each. Obtain a baseline ECG. Assess for QT prolongation or conduction abnormalities before initiating treatment. Monitor cardiac rhythm. Continuously monitor for new or worsening arrhythmias. Assess for CNS effects. Watch for dizziness or visual disturbances which may affect patient safety. Monitor renal and hepatic function. Flecainide Acetate is metabolized in the liver and excreted via the kidneys. Check for drug interactions. Avoid combining Flecainide with other QT prolonging drugs or strong CYP2D6 inhibitors. Administer as prescribed. Ensure correct dosage as Flecainide has a narrow therapeutic index. Finally, let's discuss what we need to teach our patients. Teaching patients about Flecainide Acetate is essential for safety and adherence. Explain the purpose. Describe how Flecainide helps stabilize the heart's rhythm. Emphasize adherence. Stress the importance of taking the medication exactly as prescribed and not skipping doses. Report symptoms. Teach patients to recognize and report signs of arrhythmias, dizziness, or shortness of breath. Avoid over-the-counter medications. Warn against using over-the-counter medications that may interact with Flecainide, such as decongestants. Regular monitoring. Highlight the need for regular follow-ups, including ECGs and lab tests. Flecainide Acetate is a powerful antiarrhythmic medication with significant benefits and risks. As nurses, understanding its indications, mechanisms, and patient implications is crucial for ensuring safe and effective care. Alright, well, that ends this nursing review. If you found this video useful, leave a like and a comment so we can continue to make more videos like this. See you again.